We have 2 questions in the hopper, so I'm going to pivot to our next one from Patty Quick. The question is, how do those who are experiencing homeless become kind of active in really addressing and fighting these injustices they face, as opposed to being kind of acted on or helped by this other person? So how are they able to kind of stand in actively addressing these injustices as opposed to being always helped by someone else? So I'm wondering if one of our panelists wants to take a stab at that one.
I can just say, you know, the fact that this question needs to be asked, it shows a failure of system design, you know, by the agencies, the community agencies, as well as the nonprofits that are, you know, supposedly there to be helping. But if they aren't doing that helping in partnership and by listening to and acting with the people who they are supposedly helping, then, you know, then it's not doing everything it should be. So I think in part it's incumbent on the systems to change and become more accessible. But, you know, for an individual to start down this path in the constructs that we have right now, every community has a continuum of care, which is made up of service providers and you know, the people who are actively working on homelessness in the area. Many of those, I think, have committees of people experiencing homelessness or who have formerly experienced homelessness, who are informing their policies. If they don't, they should. And working with, in partnership with some of the organizations, you know, that's that are part of those continuums of care is really a good way of starting. So reaching out, figuring out who the point person is for your continuum of care, and then getting involved there could be a good start. Joining our Housing Not Handcuffs campaign at housingNotHandcuffs.org will get you on a mailing list if you have access to email, where we're trying to help keep people informed of their rights, of the opportunities for advocacy at the federal, state, local level across the country. If there's a legal aid office in your area and you want to work on homelessness issues and potentially serve as a plaintiff in one of these cases challenging the criminalization of homelessness, that's something that's always needed. So you know, reaching out to the organizations that should be reaching out to you and maybe aren't, and saying that you want to be involved, I think hopefully if they're a good organization, they would really welcome your involvement.
Mm-hmm. Yeah. The planning groups for the continuums of care are mandated by HUD to have representation from folks experiencing homelessness or who have been there. And I can't tell you how important that is. I sit on the one in Nashville. Our state legislature, in its wisdom, has just made it a felony to camp in public places. That comes into effect on January 1st. And the folks who have experienced homelessness who are part of our planning council are screaming to high heavens and holding everybody else's feet to the fire to say, what are we going to do about that? How are we going to address that? How are we going to save people from getting arrested? And, you know, maybe we can talk to the DA to dismiss the charges, but you still have that arrest record, and you've got to understand what that does to your ability to get housing. And, you know, so it's really important to have those voices at the table.
I agree with all that, and I had wanted to share with the group. There's a website that we used early on, and then a lot of nonprofit organizations in Rhode Island have used. That's a tenant self-advocacy website. So if an individual is able to read, this website's been sort of built by tenants around the country, and it goes through common problems. It goes through how to apply for subsidized housing, problems once you're in it, how to stave off eviction, how to apply for an appeal if you're rejected from subsidized housing, sort of step by step in lay language. It's really wonderful. but I couldn't find it. But if I do, I'll send it to you after, Caitlin.
Thanks so much. And I did in the chat include some local Rhode Island info for those that wanted links to the continuum of care, some of the programming that the coalition has. And then I think most prevalent in Rhode Island is the Homeless Bill of Rights. So there's a group that operates that really tries to defend the rights of people experiencing homelessness. But I'll just say on a personal level, if someone is facing injustices, typically knowing their rights, so seeking help, but asking for supervisors. If you've got a case manager that's not listening to you, that's treating you poorly, going up the chain and advocating for yourself. And it's very challenging in those environments because you're afraid you're going to get kicked out. But most facilities, if they're funded by federal or state funding, give you rights in terms of not being kind of disenfranchised because you're advocating for your needs. So really asking just to even speak to a supervisor and potentially even filing a grievance. Those are ways that you can personally advocate for yourself. I've got another question, and I think this is very specific to Dr. Vanjani. So the docsforhealth.org, which I love, that's so great. Would that be able to be used by non-physicians, practitioners? So for instance, I'm a social worker. Can social workers use that? And I think the question embedded in this is those documents, if they're signed by, let's say, a mental health clinician, are they considered legitimate, or does it need to be the physician that completes the form?
Yeah, that's a great question, and thank you for that. There are two types of resources on the open source platform. One are pre-existing forms, and then the second are customized form letters that our group has made in conjunction with lawyers, with the goal of scaling that medical legal partnership model, since MLPs only reach less than 10% of the American population. So that first category, forms, for instance, every utility company, virtually every utility company in the country has a prevention shutoff form that does need to be signed in most cases by a healthcare provider, and there are even certain definitions for what deems someone as eligible for having their impending utility shutoff stopped. But the form letters, and so you really have to go form by form in terms of the forms. For example, here in Rhode Island, the RIPTA 2-year disability bus pass form. So again, almost every public, moving away from housing to transportation for a moment, almost every public transportation service in the country has the option for an individual who's been deemed, quote, disabled, either by the Social Security Administration or again by a healthcare provider, to have access to a subsidized public transportation pass. And so again, you kind of have to read. So here, it was initially intended just for physicians, NPs, and PAs. And then in the last year and a half or so, RIPTA expanded it to also include social workers. So now social workers can also sign that form. And for the form letters, they can really be signed by anyone. So in the housing realm, many people on this call may know that often one of the biggest barriers to housing after an individual has received a voucher is rejection by the landlord, by the housing authority. And in that, the appeal process is really important. And typically individuals have 2 weeks to appeal. And really the way to strengthen your appeal is to get character letters. And that character letter can come from me as a physician, but it can come from anyone, case manager, licensed mental health clinician. And they're particularly powerful, I think, when written in the right way and presented as a package. Similarly, in terms of retaining housing, a lot of individuals are stuck in that sort of triangle of incarceration, the shelter or homelessness, and the hospital system. And when they're not in one, they're in the other. And so people who are in housing, who may be facing an upcoming criminal court case, and who perhaps have been doing really well in other aspects of their lives, we've created a letter called Preventing Incarceration, or the Health Impact of Incarceration, that's been particularly useful here in Rhode Island. And again, anyone can write that letter to a judge just saying, here's some additional context about this person you're thinking about locking up. Here's why we think that would be really harmful. From a housing advocacy standpoint, once you have subsidized housing and you get locked up, it's over. That's 5 years on the wait list down the drain. And so judges find that really compelling and often tell our team it's because of that letter that we're not going to lock this person up. We want them to remain in their subsidized housing and not leave the carceral system to homelessness. I hope that answers that question.
I think that does. And I'll just say, as a licensed social worker, I mean, there have been versions of this forms that I have used. So it really comes down to whatever the form is, but absolutely stepping into the role and not just, as Rahul pointed out in his presentation, just kind of like, oh, well, I can't do anything about this. So I think everybody actively participating. Well, we have about a minute left. So I just want to say one last thank you to all of our panelists today. I think this was a wonderful conversation. And a big thank you to our hosts as well, Homes RI, University of Rhode Island. This is such a wonderful event, and I hope that everybody really were able to learn something new, hopefully got some inspiration about the advocacy work that we need to do here in Rhode Island and nationally. So thank you all very much, and thank you to our esteemed panelists.